Right, so today we'll be going through the common registration assessment. So the terminology of common registration assessment is new. It's a new term framed by the PSNI and also the GPhC. I'll speak to you about this in a bit more detail in the following slides. And this is essentially the term used for the registration assessment in the UK for you to be working and practicing as a pharmacist. The framework is for the 2026 assessment, and that's what we're going to be focusing on today. I asked all of you the question of whether or not you've gone through the framework. We had a mix of uh, answers. Many of you said you have, many of you said you haven't. What I will also highlight, as someone mentioned in the chat, I've put some links in the chat. One of them, where it says sign up and it's got the MicroPharm website, gives you access to a free plan on the MicroPharm platform. This free plan is something that we've never done before. And what this free plan gives you access to is access to the upcoming webinars and all of the webinar recordings for these free webinars that I'm running for trainee pharmacists. These free webinars doesn't matter if you're a MicroPharm member or not. So this is the first time that I am doing this. Also, we partnered with Locator Locum to give you a free GPhC exam infection pack. This gives you 25 GPhC style questions for infection. Anyone that signed up before with Locator Locum, I have added it to your free plan on the platform. So you can see it right there and then if you log in. If you're already a member, you already have access to these infection questions as part of your 1,000 questions on the platform. Okay, just out of interest, is anyone going to be at the pharmacy show? Anyone at the pharmacy show? Does anyone know what the pharmacy show is? Yep, so for anyone that will be there, the pharmacy show is a show for pharmacists and pharmacy technicians or anyone interested in pharmacy. It's going to be on the 12th and 13th of October. It's going to be at the NEC in Birmingham, and we are going to be there on the front row. So once you come in and you turn left, you will see us on the front row. We've got stand A08, and I'm also going to be speaking at the pharmacy show, particularly about content creation as a healthcare professional and as a pharmacist, and all the doors that it can open. And I'm going to be speaking at 12 p.m. at the Technology Theatre. So I'm looking forward to seeing you there, anyone that's coming. If you want details on how to sign up, I can share a link with you at the end. It's a completely free show. 8,000 people attend. Honestly, it's a really, really good experience. And it's worth attending. The reason why it's worth attending the pharmacy show is because the Clinical Pharmacy Congress, which is another pharmacy conference, is very close to the GPhC exam. So much more people join the pharmacy show because it's not as close to the GPhC June exam. Of course, for people who are saying November, it's quite close to November. I'll be speaking at CBC North in November as well. So although my talk is at 9:30 a.m. But I'll be on a panel discussion talking about portfolio careers in pharmacy. So if you don't catch me here, you can catch me at CBC North. CBC North, can't remember what days CBC North are. Does anyone else know? Um, cool. Okay. In terms of certificates of attendance, is that for today or is that for the pharmacy? If it's for the pharmacy show, they automatically do it. Oh, they automatically do it for the pharmacy show. So they'll scan your your badge, and then they'll send it to you after you've attended. And just a short introduction of why MicroPharm. So quite often I get the question of why should we sign up for MicroPharm? There are so many training and education companies out there. So few important reasons. The most important reason is we have a team of 21 expert clinical educators. The large majority of these clinical educators, so all but one, so 20 of the clinical educators have sat the GPhC exam like yourself, like you will be doing, and they are also experts within the fields that they're teaching in. One of the 21 currently works as a, a respiratory registrar, but he is just so good at teaching that I said we really need you to teach the respiratory system module because he has a very good understanding of pharmacology as well, and explaining how different medications work. So I really wanted him to teach. We have a very strong team of 21 expert clinical educators that are specialists in their knowledge and they have a lot of familiarity with the GPhC exam. So this is what I thought was very important for MicroPharm. It's one of the reasons why we sit slightly more expensive than some of our competitors, and there are many platforms that are out there that are we have a much more affordable cost. So the platform I used cost me £1,800 when I was a pharmacist in 2000 when I was training for the GPhC exam in 2017. So our platform is 499 and we have a pass guarantee. But one of the most important things was to have a strong team of 21 clinical educators that are experts in the field. So it's not just a few of us teaching you. And I wouldn't want to teach you a topic that I've not spent several years on in practice. So I thought that was something that was very important to me. We have a pass guarantee. So if you don't pass, we'll support you until you do. So you have two options. If you complete the entire course and answer all the practice questions correctly at least once, you can go through the questions as much uh, as you want. But if you do this and you don't pass, I give you two options. I either give you a full refund, um, or I will extend your membership until you pass the exam in the reassessment. It's a complete package, so we give you your study guides, clinical modules, so you get access to over 500 bite-sized videos. You get your law, your calculations, so lots of calculation modules and lots of calculation questions. You've got your webinars, like one from today, and we'll have a mock exam at the end. And all of this is all in one place, and we have a 98% pass rate. So this is why we think you should really consider us. But of course, I leave that completely up to you. And a lot of our webinars are still free for you to attend, and you can get a free access to the recording with the free plan. We have some upcoming webinars, so I've put this in the chat for you. It's the Luma link. We have on the 11th of October, we have Parkinson's disease. We had the cardiovascular system was supposed to be on the 13th of October. I moved it to the 14th of October. Anyone that was registered would have got a notification. The reason why I moved it, I realized that it's on the evening of the pharmacy show. So I thought I'm just going to be shattered. Might as well give myself a bit of a break and move it to the next day. And then we have CNS, so epilepsy and depression coming up as well. So what is the common registration assessment? So the CRA is the final exam trainee pharmacist must pass to join the register and practice as a pharmacist in the UK. When we used to use the term GPhC registration assessment, that term GPhC registration assessment has been replaced by CRA. And the reason why it's been replaced by CRA is now the GPhC, which cover England, Scotland, and Wales, and the Pharmaceutical Society of Northern Ireland, so the PSNI, have now joined together to have the same name for both, same name for both people that are studying in Northern Ireland and those in England, Scotland, and Wales, and it's called a Common Registration Assessment. So it's the same across the UK, and they say this is to ensure fairness. In terms of the format of the exam, can anyone notice whether the format of the exam has changed? Can you let me know in the chat? Is this different or the same in terms of part one and part two? Yeah, it's the same. So nothing's changed there. They've changed the naming of part two, but ultimately it's the same thing. Quite often people will call part two clinical. The reason why they don't call it absolutely clinical is you can get some calculation questions in part two. Um, but part two is now called safe and effective care. I'll go through what they mean by that. So why is the common registration assessment important? Well, firstly, and these are all the things that are stipulated in the framework. This is not coming from myself. This is what is stipulated in the framework, and the purpose of this webinar is to make it easier for you to understand this 20-page document. So all of these points are as stipulated in the framework. So the intention behind the common registration assessment is to protect patients and protect the public. It's a way for them to prove that every new pharmacist can apply their clinical knowledge safely in real world scenarios. They can understand law, ethics, and professional standards and can make safe and effective decisions under pressure. For them, you passing the common registration assessment is proof that you are ready to practice as a pharmacist independently. So you have the ability to apply the knowledge that you've gained during university in real world practice scenarios. The thing that's really important for the GPhC and PSNI is if you consider the fact that there's roughly 30 pharmacy schools in the UK, it's important for them to see that all the pharmacy schools have equipped you with the knowledge that they feel is required for you to practice as a pharmacist. Of course, those 4 years of studying will be different from one university to another, but they ultimately need the entire cohort of the pharmacy profession and those trainee pharmacists to have some level of similarity in terms of their knowledge and whether or not they're equipped for practice. So the common registration assessment content areas. This is the way they've sort of proposed this and the way they've highlighted this slightly changed from previous years. Ultimately, it's very similar in terms of content. It's just the way it has been framed. So the exam questions cover three key areas. So it's clinical therapeutics, which is all the therapeutic areas, as we've mentioned in previous webinars. So this includes the main BNF topics, which are 15 in total. I'm going to show you how they're going to show you the weighting of these different therapeutic areas because it's slightly different to how they've mentioned it before. So when I used to use terminology like high, medium, or low weighting before this framework came out, they really scrapped the reference of high, medium, and low weighting. So they removed that sort of those terms altogether, and you won't see them in the framework. In terms of law, governance, and regulation, this is one key area in its own right, but again, pharmacy law has always been assessed in the exam. So applying pharmacy law and professional standards to real life scenarios, again, has always been assessed. And pharmacy and healthcare calculations, so applied maths for real world pharmacy practice. So this is a table that you will see in the GPhC registration assessment. You will see these content areas highlighted, and you will see that really most of the therapeutic areas sit in similar positions to as they always were. So this is like where high weighting used to sit, where medium weighting used to sit, and where low weighting used to sit. There's one that has changed fairly significantly. Does anyone know which therapeutic area that is? No, MSK. Yeah, so musculoskeletal and joint diseases used to be classified as a low weighting therapeutic area. Previously, going through previous terminology that they used to use, that used to be up to 10% with all the other low weighting topics. So that's moved into a position that if we're using the previous terminology would be considered more medium weighted So you can see where musculoskeletal and joint diseases is here. So it sits in a position that's more medium weighted. That makes that does make sense for me. The musculoskeletal and joint disease chapter is a very weighty and chunky chapter, and the fact that it was low weighted before, it actually moved down to low weighting, not many years ago. It's not a huge surprise that it's moved up again. And that's primarily because what they've tried to do with this table is they've tried to base the questions on how common the conditions are in practice. So they really want to reflect prescribing patterns in the UK. And there are some very important conditions that need to be considered that are covered in the musculoskeletal and joint disease chapter. In terms of the musculoskeletal and joint disease chapter, the way we've covered it is extremely thorough, and we've essentially treated it as a medium weighted chapter anyway. The reason why we had to do that is because it's such a big chapter. Naturally, when we're giving you videos surrounding that on MicroPharm, they're just going to be they're going to be thorough compared to other low weighting chapters. Many other of the low weighting chapters are smaller in terms of their quantity, so naturally they're going to be smaller in terms of the content provided. So we just had to give you a much chunkier, essentially module. So you're going to have good coverage in terms of musculoskeletal and joint diseases. So there's extra focus in areas where prescribing errors are more common or more likely to cause harm. And that's particularly because patient safety is of importance for this assessment. In terms of high risk medicines, not too much has changed. However, there has been slight changes in terms of sodium valproate being mentioned in its own right, whereas this has been changed to teratogens, so medications that essentially are teratogenic. Again, not a huge surprise. What what does it mean for it to be a high risk medicine? What does the GPhC essentially and the PSNI why do they highlight high risk medicines? And how does it impact your assessment? Anyone, how does it impact your assessment? It's the Pharmaceutical Society of Northern Ireland, and the only reason why I mentioned the PSNI is strictly speaking, it's not a GPhC exam anymore. It's only not only a GPhC exam, it's GPhC and the Pharmaceutical Society of Northern Ireland combined together, giving you one assessment. So I mean the same thing when I say this. I don't want anyone from Northern Ireland to feel neglected. So does it, no one knows why the high risk medicines, why are you even given this list? I've mentioned this before, and the intention behind it hasn't changed. It's yeah, so essentially it's a guaranteed question from each point. Now, if you're thinking, yeah, so it's a guaranteed at least one question on each point. Honestly, it doesn't give too much away. Your part two paper is 120 questions in total. They're guaranteeing this essentially this handful of questions. And in many circumstances, the reason why I don't want you to be too worried about any minor changes in this is, were you intending to neglect the importance of isotretinoin for the exam? Honestly, I doubt it. I think a lot of people, once you start to prepare for the exam, you will start to understand which medications have require a pregnancy prevention program. You're going to start realizing that digoxin's an important medication and it has a narrow therapeutic index. So don't be too hung up on this high risk medication. if you prepare for the exam holistically, you will naturally cover these high-risk medications very well. So I don't want you to be too worried. In our webinars, we will have extra focus on these high-risk medications. So you can leave that to us. We will make sure you're prepared and have a good understanding of high-risk medications. We will cover insulin thoroughly. Insulin is my area of expertise. It's also, for very personal reasons, is my area for expertise because that's my insulin pump. So I'm very passionate about teaching diabetes well, and I will make sure you're prepared when it comes to insulin as well. And of course, with all of the other therapeutic areas that fall outside of my remit, which my remit is an infection and endocrine system, we have specialists that are going to teach you and prepare you for the exam. Talking about time-critical medications like Parkinson's disease and anti-Parkinson's medication, we also have our webinar on the 11th of October, which I'm hoping you're all signed up to, which is free, where we're going to be going through Parkinson's disease. We have Elaine, who is an advanced specialist pharmacist in geriatric medicine and has a lot of expertise when it comes to Parkinson's disease. Has everyone signed up to that webinar? If not, let me just put those links. Use the Luma link to get signed up to it. Okay, so there is special dedication in the framework when it comes to safety alerts. So the exam does expect you to know about MHRA and CHM safety alerts. These are found within their respective monographs in the GPhC exam. So when it comes to how we prepare you for these, when we're going through the CHM is the Commission on Human Medicine. So sometimes when you see a safety warning under the monograph, it will either say this is an MHRA warning or this is a CHM warning, but ultimately the warning is something that's they think is important for you to know about medication. How do you know which ones you need to? So this completely depends. It's a combination of factors, and that's why there's no essentially one size fits all thing for this. The MHRA warnings and the CHM warnings that are more important are for chapters and for medications that you're more likely to see in practice. And how do you know which ones you're more likely to see in practice? Goes back to this content areas section here. So essentially, medications that have these warnings that fall into the first four, which is what we used to call high rating, these are more likely to come up in the assessment. If you go through previous examinations, so the previous exam in June, 68% of the exam covered the first four content areas for this exam. So, of course, the medications with MHRA and CHM warnings in these first four are more likely to come up. So that depends on the medications covered in this. What we will try to do, we do highlight MHRA warnings in any webinar that we do, that we're covering medications that fall under this. So for example, when I'm teaching you infection and we're going through fluoroquinolones, I will cover the MHRA warnings surrounding fluoroquinolones like ciprofloxacin because they're very important. So we'll cover those. They're in the study guides as well. But we will organize a webinar for you where we will go through what we feel are important MHRA and CHM warnings. But this chapter is a bit like the module that I've done for drug interactions. It's a good starting point. However, the list is huge. Really, I want you to focus on, whilst you're going through different videos and you're going through different summaries that we're providing you for different medications, we're going to cover MHRA warnings surrounding those. So start to familiarize yourself with, when you see fluoroquinolones, you should have a good understanding of the safety concerns surrounding them. For example, the lowering of seizure threshold and the possibility of seizures, the risk of aortic aneurysms, have a good understanding of these MHRA warnings, tendon rupture. But I'll go through these when I go through. I've gone through these in the videos that are already on the platform, particularly for Pro Plus members, and I'll go through these in the webinars as well. So what do these alerts cover? So any drug recalls, any safety warnings, any new contraindications or monitoring requirements. So as part of professional practice, of course, naturally, as a pharmacist, you should be aware of any MHRA alerts and any updated MHRA alerts, because these will impact the decisions that you make when it comes to managing patients. In terms of the exam structure, both assessments, I'm sure most of you or all of you already know this by now, but but both assessments, so both parts of the assessment should be sat on the same day. You must pass both. There's no compensation. So what they mean by that is, let's say, roughly speaking, the pass rate, and this changes every year, but it's around 70%. Let's say you get 90% in part one, but 65% in part two. They don't average out the marks. They need you to pass both parts of the assessment, and they will stipulate what the pass mark is for each part of the assessment. This changes every year. It depends on what happens in the assessment, what happens in the standard setting, what happens when they finally decide what those marks are going to be, and whether or not they remove any questions from the assessment because they thought, after reflection, they thought this question was slightly unfair or ambiguous, and because of that ambiguity, we're going to remove the question. But all that happens in a process called standard setting. Standard setting is not standard sitting, standard setting. And yes, you do sit both exams one after another, but you get a lunch break in between. So I want to very, very much highlight that you get a lunch break in between. In terms of the part two paper, you have 90 single best answer questions. What are single best answer questions? Yeah, so more than one question can be correct. Essentially, more than one question, more than one answer can be correct. So more than one option can be correct, but one is more appropriate than the other. And this is very common when it comes to you considering clinical decisions that you're going to make. You may have a patient that's in front of you that has a urinary tract infection. There's three antibiotics that you can you can safely use for this patient, but one just makes more clinical sense than the others. So this is the reason why single best answer is used in this format, because sometimes it's not a clear cut. There's only this option and the other options are completely inappropriate. Sometimes there's three options that could work, but this answer makes more sense than others. SBA, so single best answer has always been there. So any questions that you will, let's say, when you're familiarizing yourself with practice questions, there's always been single best answer questions, and they've always for essentially an extremely long time, so at least for the past 5 years, this format of 90 single best answer and 30 extended matching questions has been the same as well. Extended matching is slightly different. I'm going to go through this in later slides as well. Can anyone tell me what their understanding is of extended matching in the meantime, if you do know? So it's a computer-based assessment as well, and it's used. They're going to use the SERPAS assessment platform. Really, that makes no difference to your understanding of this. All you need to know, which is important, is computer-based. Yeah, so you'll get 8 different options when it comes to extended matching. You'll have a topic area, and then you'll have several questions. So these questions could be like, which antibiotic over here is contraindicated if a child is under the age of 12, and then you have to pick doxycycline. Then the next question could be like, which antibiotic can cause tendon rupture? And again, you're using the same options when it comes to the questions. One thing that's very important of this chapter, you've got 8 options. With these 8 options, you may use the same option multiple times. You may use one of the options once, and there may be some options that are not used at all. In terms of calculations, I'm going to just do this very briefly, but calculations has gone through some changes. In terms of the wording of some of the topic areas, they have removed some. Um, However, the overarching thing is the addition of medical statistics. We are going to have a webinar on the 28th of October at 8 p.m. I haven't uploaded the details yet because I just confirmed it with Enketia. But for everyone that's signed up to the free plan, I will be notifying you via email. But Enketia is going to go through a calculations workshop, and he's going to spend a good amount of time at the start of that workshop going through all of these changes. With these are the topic areas for the assessment. There's 40 calculation questions, and you've got approximately 3 minutes per question. So in terms of part two, like I said to you, there's 120 MCQ questions with single best answer questions. You'll have 5 options, and you have to choose the most correct. Yeah, so with medical statistics, what we're going to do, Enketia is going to go through an overarching understanding of what medical statistics is, and he's also going to work through examples of medical statistic questions on the 28th of October. So I will upload, so there's not a link yet. No, it's available for anyone. You don't have to be a member. You don't have to be a member. Can someone? We are going to be doing live workshops in London. Is anyone here based in London, by the way? Is anyone here close to Acton? Right close to Acton, so it doesn't get mixed. And can anyone make it to Acton for a 7 p.m. close to Acton? No. So who can make it to Acton for 7 p.m. on a Monday and Tuesday? I need to do the reason why I want to do this now. I'm gonna do a thing. Uh, Let me do a poll. I want to see if this is worthwhile doing. I can't do it on a Saturday, and I'll explain why I can't do it on a Saturday. Yeah, this is what I was expecting. We're still getting good numbers. We've got 8 people so far. The reason why I can't do it on a Saturday is I'm doing it at my cousin's shop, which is Atom in Acton. If anyone in Acton's probably heard of it, because I work as a barista there. But I want to do live sessions where we go through essentially infection together and we go through GPhC style questions. There's 13 people showing interest. I want to do the tickets really cheap. So they're going to be £10 for your ticket, but with the £10, you will get a free matcha or specialty drink of your choice, so Spanish latte or anything like that. We have decaf options as well, and you get uh, a dessert or a sweet treat of your choice. So the reason why I'm doing the £10 is, of course, I want to give that to my cousin to say thank you for allowing us to have the entire space. We're going to have the entire space for 2.5 hours, and we'll go through it live. I think it'll be really nice to have face-to-face sessions, and I think £10 is an affordable session because you can claim that £10 as well. So I'm going to upload details of that. So it's good to see that at least 15 of you are interested. If I get at least 10 to 15 people signed up, I think that would be a good turnout. Um, but yeah, I think it will be a terrible recording because of the layout and the way it'll be. It'll work really well live. I think as a recording, I would really struggle. But yeah, I want to do it as a regular thing. So I'll share details of that. It's good to see that there's enough interest. I'll share details of that soon. Okay, so 120 questions in part two. Single best answer, so 5 options. So choose the most correct option. And extended matching question. So 8 possible options. You have to choose the best fit. Yeah, normally I would record something like this in a live session. You don't need to be sorry, but it's just because we're doing it in a coffee shop. I'm not sure how well it work. Okay, so what does it cover in part two? Applying your BNF knowledge, making safe decisions in patient scenarios, and applying law, governance, and regulation, as you'd expect. So let's talk about some examples of what this would actually look like practically. So an SBA example, which is the most appropriate first-line antibiotic for a 25-year-old woman with uncomplicated cystitis? And then you've got several options: nitrofurantoin, ciprofloxacin, trimethoprim, and one is the most appropriate compared to the others. Can anyone tell me what the answer for this is? Just out of interest. Nitro. Why not trimethoprim? Resistance. Very good. So trimethoprim used to be the first line. It's not anymore, and it hasn't been for many years. We've used trimethoprim just so much that I was actually working in the antimicrobial field when this decision was made to no longer make it first line. We use it so much that national resistance rates are a third. So 1 in 3 patients, but really we're talking about E. coli. So 1 in 3 E. coli that is present has developed resistance to trimethoprim. And that's why we use nitrofurantoin instead, because rates are lower. If we continue to use nitrofurantoin the way we are using it at the moment, we're probably going to have a situation in the future where nitrofurantoin resistance rates are really high. But that's just naturally what happens when you make a medication first line when it comes to antibiotics. Extended matching question. So yes, so nitrofurantoin first line, EMQ. So it'll tell you a theme. It'll tell you yeah. So it's still nitro on nice as well. What it says is it says nitrofurantoin, or you can use trimethoprim in brackets. It says if likelihood of resistance is low or resistance rates is low. So in most cases, you won't have the midstream urine culture results yet. So you'll be treating this patient empirically. Empirically is just a term that we use when we're treating a patient uh, without the results from the microbiology lab, which is most patients with a lower UTI, and the first option would be nitrofurantoin. For EMQ, you'll get a theme, so antihypertensives. You'll get a scenario, so patients, let's say, you'll get different scenarios. So, uh, what about this patient that has asthma? What should we be using? This patient has diabetes. This patient is pregnant. What should we be using? Again, this is a rough example. And then it asks you to choose the most appropriate antihypertensives from 8 options. So this, you can have multiple scenarios for the same theme. Does everyone follow what that means? So multiple scenarios for the same theme. So the theme could be antibiotics, but you'll get multiple different scenarios. Um, and you have to choose the most appropriate antibiotic, for example. You have to choose the most appropriate antihypertensive. There are multiple themes, yes. So for the 30 questions, it's not just one theme, there are multiple themes. So uh, one theme could cover 5 different scenarios, but you will have multiple themes when it comes to extended matching questions. Yes and no. Most likely, like in most scenarios that I've seen, they're not uh and they're not as lengthy. Some in many cases the SBAs can be more lengthy. You have to also take into consideration um up to 25% of the questions can be resource-based questions. I'm going to talk to you about this as well. So those SBAs can be quite lengthy. In many cases, the EMQs would give you like antibiotics, but then say which antibiotic can cause tendon rupture, for example. So in some cases they can be considered more straightforward than SBAs. What are the resources that will be provided? So one thing that's very important is you're not going to get a full BNF in this exam. And you don't need a full BNF in this exam. You're given the short extracts from the questions that you need. This is not an assessment to see whether or not you can use the BNF. And thank God for that, because that would be very, very time consuming. So hopefully it's a bit more straightforward because you get the short extracts to use in the questions. So you'll either get a BNF or children's BNF extract, or a summary of product characteristics, so the SVC, or prescription charts like a MAR chart or inpatient chart if they're in hospital, any labels or treatment algorithms and guidelines, and you use this in the resource-based questions. We'll go through some resource-based questions when we practice through questions in our future webinars as well. What patient populations are considered? So if you're working in community, so MAR charts are care home, essentially charts that are used in the care home. I'm gonna try, and you'll actually see these in community in some instances. But I'm gonna give you, let me download a picture. I'm gonna show you what a MAR chart could look like. So this is what a MAR chart could look like, for example. This is not a real patient, by the way, it's a test patient. But that's what a MAR chart could look like, and it's an administration record for the patient. Because it's very useful, because if a patient is in a care home, you know exactly what they're taking in and at what time. So they may want you to analyze a MAR chart as well. Some patient populations that are covered, pediatrics, pregnancy, breastfeeding, older people, people with renal or hepatic impairment, those with multiple comorbidities, as you understand, but especially with elderly patients may have multiple comorbidities, so it's not always as straightforward, and you're not always just treating one, managing one condition. And palliative and end of life care. All of these patient populations that are covered should not be new to you or should not be a surprise. This is natural for them to cover many different scenarios with a wide array of different patients. So let's finalize on what I think, I think you should study effectively, and just a few points. Daily practice for calculations is just like super. Even if you're just doing 1 or 2 questions, just do 1 or 2 questions to familiarize yourself. It's going to take you 10 minutes to do 2 questions. Spend some time just familiarizing yourself with different calculation questions. You can't do enough. There's no such thing as I've done enough calculation questions. So daily practice. Mix your topics up. So don't spend an entire month on one chapter. Try to mix up different chapters. This leads to a process in terms of when it's scientifically explained. It's called inference making, where you can essentially look at different aspects of the BNF, different conditions, and you start to make links between them and what's important. So try to mix the different topics that you learn, and it's less boring when you mix it up. Use exam style questions when it comes to preparing. Of course, those of you who are Pro Plus members have access to over 1,000 GPhC style questions, and you also have access to our live webinars as well. Work on time management. So simulate exam timings. It's incredibly important for you to be working well within those times. What I normally say to uh, my mentees, so the people that I mentor for the exam, I normally say to my mentees, you should be working where you've got 20% of your time left when you're working through the exams questions, because you allow for exam nerves on the day. And use resources while practicing. So try to find for practice questions that use resources that you're going to receive. With the practice exam questions, how will we know which resources we will be given? I'm not sure what you mean with the question, but how you know if you've been given a resource, or it'll be you get resource packs in the MicroPharm membership. So resource packs for any practice, any resource questions. If you're doing a session with me, I'll give you a QR code, and that QR code will lead you onto the website that you need for the resource-based question as well. Exam day tips: bring an approved calculator. You don't want to be using their computer-based calculator. read the question carefully, so avoid rushing when it comes to a question. Manage your time, so don't spend too much time on one question. If you're really struggling, if you're at the point of 5 minutes or 4 minutes when it comes to like let's say you're even at the point of 3 minutes when it comes to a clinical question, be mindful of the fact that you have just over a minute for each question when it comes to the calculations, when it comes to the clinical paper. Move on. Um, Always think, what is the safest uh, option for the patient? Because that's what you want to consider. For example, that's what you want to consider, for example, when you've got SBA questions. And stay calm and structured. So have a good idea of where you should be at each point of the exam. 1 hour into that paper, where should you be in terms of the question number? Where are you comfortable? Where do you feel like um, where do you feel like you should be from the practice sessions that you've done? And keep an eye on that. So you're managing your time effectively. And when it comes to the exam questions, sometimes it may not be obvious what the correct question is, but you may be able to identify the correct answer by eliminating the wrong answers. Okay, so this was the session for today. Hopefully you found uh, this useful, and I'm going to answer some of your questions now. So I'm gonna